They say that 1 in every 9 to 10 men and women are affected with cancer worldwide.
I think Deepika Padukone, she played a very important role in breaking those stigmas in regards to mental health. The biggest problem is smokers shifting into vaping is lesser, but people taking it as a fashion trend and coming into vaping is the greatest hazardous thing that we are seeing.
Correct. Hi everybody. So today we are very excited to welcome you to the first episode of our one-of-a-kind podcast series by Arete Hospitals called Beyond Medicine. So in this, we will try to convey expert knowledge through a very candid conversation. We'll try to cover the pressing topics which are more relatable to you rather than just talk about medicine. I'm Dr. Vijay Karan Reddy. I'm a radiation oncologist at Arete Hospitals, Hyderabad. And we are very lucky today to have with us a very good friend of mine and one of the leading psychiatrists in the city, Dr. Virinchi. Hi, Virinchi.
Hi, Karan. Thank you so much. Thank you. Thank you so much for having me here.
Today, we thought we'll talk about the two most pressing topics, I should say, that are, concerning many of us. We see the increasing incidence of cancer and the increasing awareness about mental health and how it's affecting our physical health. So we have Virinchi and myself, we'll be talking about the general lifestyle changes that we see in the society today and how it's affecting both cancer and mental health. So talking about cancer, now the easiest way to understand that the cancer incidence is increasing is because we keep hearing that more and more. Every family, like it used to be for COVID, every family, every friend, everywhere I go, in my social circle also, everybody has somebody who is affected with cancer. So right now, the incidence from the time that I have studied 10 years back, from my undergrad days to now, the incidence has gone up so much that right now they say that 1 in every 9 to 10 men and women are affected with cancer worldwide. And in India itself, last year, we have seen about 14 lakh new cases. And this is only going to multiply in the next 5-10 years. So like cancer, we are more and more seeing celebrities and prominent personalities talking about the importance of mental health. So let's have Virinchi tell about the awareness of mental health these days.
Well, you see, Karan, I think very similar to the statistics that you've spoken about cancer. In the recent times, the number of cases that we see with mental health has drastically increased, especially the post-COVID era, because COVID was the time when people tried to understand and started understanding that mental health also plays an important role. For the longest time, we always focused on physical health issues, but sitting in those four walls, living with uncertainty, I think gave us an understanding about what mental health is.
So do we have many of these celebrities to thank us for that? Because that stigma of going to a psychiatrist, people used to think only because you're mad, you're going to a psychiatrist. But there's so much more acceptance to it right now. Do you think we have celebrities to thank for that?
Undoubtedly, yes. And especially when we talk about the Indian scenario, I think Deepika Padukone, she played a very important role in breaking those stigmas in regards to mental health.
That's true. I think she's the one who actually kick-started everything. Absolutely. More and more people came out talking about it.
So true. And, because, for the kind of things that she's already achieved and the stature that she has, when she talks about it, I think it gave way to many other celebrities also to come forward and talk about it. And now when we look at the statistics, the World Health Organization says that 1 out of every 4 individuals are going to develop a mental health issue at some point or the other. So that clearly explains that nobody is actually immune from developing mental health issues.
So I think we chose the right topics, right? 1 in 10 versus 1 in 4.
Absolutely.
Okay. So moving on, what we thought right now, the one thing that we can relate from both cancer and mental health because of addiction is vaping. A lot of us don't know what are the adverse effects of vaping. It has become more and more prominent in, younger age group adolescents. They're exposed to nicotine much earlier. So can you tell us something about, because I'm sure you will see a lot of people who are addicted to smoking, but how vaping has changed that?
Well, if you ask me, Karan, one of the greatest misconceptions that people have about vaping is that vaping is safe.
Correct.
So now, like they say it in a quotation, your eyes see what it wants to see and your ears hear what it wants to hear.
Correct.
So
that's denial.
Right. So very long back, I'm sure, most of the times when we go to family gatherings, there is somebody who tells us, my doctor told me to have 2 drinks. So what the doctor actually said was, don't have more than 2 drinks if you drink.
Correct.
So similarly now when it comes to vaping, yes, we agree that vaping is less harmful than smoking nicotine. But now the misconception is that people say vaping is safe.
Correct.
And now if you look into the recent studies, a study by the Johns Hopkins University in 2021 talks about more than 1,000 chemicals which are not yet identified, which we don't know what it does.
Correct.
Have been, seen in these vapes. So that clearly speaks about how vaping as a culture has come into, nowadays it's become a fashion trend.
Correct.
That, you carry a vape and you talk about vaping. The biggest problem is smokers shifting into vaping is lesser, but people taking it as a fashion trend and coming into vaping is the greatest hazardous thing that we are seeing.
Correct. So that is the biggest thing. Like for you, addiction, when you're vaping, apart from the chemicals that it has, the main thing is nicotine. Right. So kids at a very young age are exposed to nicotine. So it is harder for them to get out of the addiction of nicotine. Or like if you see in the US, Juul was actually, they sued the company. It shut down because that's what they found. Children sitting in school in 10th, 8th grade, 9th grade, 10th grade are having a vape in their hand. And they're exposed to nicotine addiction at a much younger age group.
Right. Now, since you're talking about nicotine addiction, I think it's important that we say that nicotine addiction is as bad as addiction to cocaine or heroin, because it is modulating the brain. There are some changes that happen to the brain tissue, and these changes happen both structurally and chemically. All of it, which is at the end making the brain weaker and weaker. And like you said, once somebody gets into that whole addiction of it, it starts impacting the different dimensions of their health. And if you look into the latest studies, people getting addicted to e-cigarettes or vaping in the last 20 years has gone up from 7 million 20 years back to 82 million. So that's a 12 times increase in the number of people who are vaping. And most of them believe that it is absolutely safe and it is not causing any damage to them. I'm sure, while we are talking about the nicotine addiction, vaping has a lot of other health hazards too. But in your day-to-day practice, do you see anybody, who are using vapes and, coming with any particular physical health issues?
So in terms of cancer, it is, everybody is dying to actually work on it, study on it. It's too early to say that vaping causes cancer. It definitely, the kind of chemicals that you get through cigarette smoking versus vape smoking is definitely lesser. Like you said, there's still a lot of them yet to be identified.
Right.
But we don't know the adverse effects of it yet. So when you talk about a vape, we don't know what they put in it. They add something for color, they add something for smell, they add something for flavor. So we really don't know what is put in it because there's no regulation and we don't know how it's going to affect our body. So as of now, it's too early to say that vaping actually causes any adverse health effects or even cancer. But what do you think about vaping, the positive, the flip side of it, vaping being used for treatment?
Well, I think this is again something, very wrongly understood by most of the individuals. It's very common when I see students or youngsters who come to me and say that I have started my own treatment of reducing smoking by switching into vapes.
Yeah.
I think something to be said in bold letters is vaping is not an FDA-approved treatment for nicotine cessation. Now what happens is, something very interesting that you said is the regulatory bodies of vaping. Now in a country like India, there is no regulatory body for vaping. Now these vapes are bought from overseas or there are some local individuals making it. So we do not know how much nicotine is there in it.
Correct.
I could be believing that I am consuming lesser nicotine and I continue using it throughout.
Yeah.
While I do not know if that nicotine is more than what the conventional cigarette has.
Correct.
And on the other hand, an interesting study that I was reading, which was done by Ohio University, was when they tried to compare people who had conventional cigarettes versus people having cigarettes and vape.
Okay.
In these two groups, they saw more cancer risk at cigarettes and vape.
Okay.
So now, what are these chemicals that are causing that fourfold increase is something that has to be discussed, because like you said, there is very little evidence, but there is so much that is unknown. So you need to tell us if there is, anything that is known which could be causing cancer, or is vape actually cancer-free?
So next topic that we'll be talking about is basically, to keep it very simple, you would call it Zomato and Swiggy, but you should not find fault with them because they're just delivering the food. But processed foods is what we want to talk about, how it affects mental health and how processed food also can cause cancer. So we'll start off with mental health. So how do you think, when we order food from somewhere or when you buy food in a supermarket, we really don't know where the food is coming from, right? Swiggy, there are many restaurants, but at the same time, there are many cloud kitchens. Correct. We don't know in what conditions they're cooking and what kind of materials that they're using. So how this has become a daily thing for everybody, because being a professional, you don't have time to cook for yourself, you're living away from family, you tend to order more food, get more food from outside. So how do you see this affecting mental health? Does it actually affect mental health?
Undoubtedly it does, Karan. Firstly, when we talk about these foods, for basic understanding, let's try to divide them into 4 categories. Unprocessed food, the fruits and vegetables that we order.
Correct.
Second are processed culinary foods, which we use in adding into the real foods. It can be honey or it can be butter.
Correct.
And then comes the processed food that we have, where we have these foods which have a shelf life. And, then you bring it to the kitchen and then you start using. And then the last one is the ultra-processed food, especially when we talk about, the carbonated drinks or, the most healthy breakfast cereals that we talk about. These are ultra-processed foods. Now, research worldwide done on cancer and mental health, especially one study done by the University of Vienna, clearly speaks about how ultra-processed food has the greatest risk for developing mental health issues as well as cancer. I'm sure you know better about the cancer part. One thing is, all of these foods have something beyond what we usually use in our kitchens or what restaurants give us.
Yeah.
Bhagavad Gita says, eat food only up to 3 hours of shelf life. So when it is going beyond those 3 hours, you need to add something. And what we usually add is excessive artificial sweeteners or sugars.
Correct.
And then we use oils, and then we use starch, and all of them cause immense inflammation in the brain. And all of this can lead into greatest mental health issues. 2 studies, one from the USA talks about a study done on 10,000 individuals, spoke about how ultra-processed food can cause depressions and anxiety. Another study done in the year 2022 in Mexico, 11,000 individuals were studied, and ultra-processed food was clearly shrinking the brain. So there is a cognitive decline happening in youngsters, which normally happens after 70 years.
That's scary, actually.
Right.
I mean, I've never heard of studies having so many people, 10,000, 11,000, so you can't deny it.
So true. Yeah. And cancer is something that is not much spoken about in regards to these foods, but you're the expert to talk about it.
So good that you brought that up. I have seen, even during my teaching or post-graduation days, I used to come across patients I used to work in a government institute. So many of these people who from, lower socioeconomic group come to me. They are not exposed to ultra-processed foods. What they eat is regular food, right? So I have many patients like that who come to me and say, I've never had non-veg in my life. I've always been a vegetarian. I've never smoked in my life. I've never drank in my life. How come I'm a Brahmin, and how come I got cancer.
Right.
So apart from actually getting these foods from a restaurant doesn't mean that you have to be rich to get food from a restaurant. Even when you buy your fruits and vegetables outside, the kind of fertilizers, pesticides that we use, so it starts at that level, right? So you're getting it from the farm, it goes to a supermarket, then you get it. Whether it's coming directly from the farm to you, we have so many farm to table concepts today. But still, within the farm, what is happening, it's not regulated. The farmer is desperate. What pesticides he's using to get more gain, we never know. So this regulation has become a big issue. So like you say, your body is a temple. You have to be aware of what is going into it. One is through the nose, that is smoking that we spoke about. The other is through the mouth.
Right.
So that is the food that we are eating. So when the food comes to you, be aware. Even organic farming that they talk about, they say organic, but nobody really knows what organic means, right? Up to what level you can call it organic. So right from the time that you get your food, where you're getting it from, how you're cooking it, how you're processing it, every step matters. I know as much it is very difficult to keep a track of everything because you have your own daily life to go ahead with. But to be aware, when you're buying something, read the label, read the box. When you're ordering something, make sure that you know where it's coming from. So little small steps that you can take. I think processed food has become one of the largest causes of the increased incidence. When you talk about lifestyle, more than smoking. Smoking has been there for 40, 50 years.
Correct.
And people used to smoke more back then than they are right now.
Right.
But I think processed food actually is the main reason why the incidence of cancer is going up. And as indirectly, when you have all these processed food with all these additives, obesity comes into picture. Now you're sitting at home, you're ordering food, having wrong food, and then you're sitting at home having that wrong food is causing you to put on weight.
Right.
Right? Your fasting glucose goes up. Now, when we talk about the medical link to processed food and cancer, main thing is that you have to maintain an alkaline environment in your body. As soon as it becomes acidic, the more acidic it is, the more chances of you getting cancer. So when you talk about alkaline, simple things, we are just going through that. I was very surprised. Now you mentioned breakfast cereals, right? So breakfast cereals actually like processed food.
And we have all the celebrities talking about how healthy this is.
Healthy it is. And we feel very healthy when you talk about breakfast cereal. So we're having breakfast cereal in milk. The commercial milk itself is again processed. When you buy bread, it is processed. We have salted peanuts thinking we are eating something healthy. That again is very acidic.
Right.
So try to keep more and more fruits and vegetables in your diet rather than these processed foods. So instead of peanuts, you have dates. When you talk about fruits, if you want to have juices or fruit juices, lemon, orange, apple, all these bring in, alkaline properties, alkaline environment. A cell in your body is safer if it is alkaline.
Right.
It gets riskier if it is acidic. So I'm not saying completely stop having non-veg or completely stop going to KFC or McDonald's. You can do that, but you need to compensate your body. You have to add that alkaline to bring down that alkaline level. So I spoke about processed food causing obesity, causing cancer. Now I want to ask you about how obesity is again related to mental health. Because when you talk about cancer, obesity causes almost all cancers, a risk factor almost all cancers, most commonly breast cancer.
Right.
So how does that, affect mental health?
Well, I think something interesting that you said was, in a house of 4 members, there could be one smoker, but all the 4 of them are eating the same food. And if it is the ultra-processed food, it's 4 people at a risk compared to that 1 person at a risk.
Correct.
Undoubtedly, obesity has adverse effects on the brain's health. I think one of the most important things is, like we said, the added sugars is causing a lot of inflammation, which is slowing down the brain. And once the brain slows down, biologically, we see a lot of neurochemicals that are necessary coming down. And this is a cyclical process. There is a lot of sugar slowing the brain, and this slow brain, in a state of stress, craves for more sugar. So all the sugar cravings that happen during stress is because of this slowing of the brain, which could be again being done by the sugars itself.
It's like having a tub of ice cream when you have a breakup.
Absolutely, absolutely. So that way, undoubtedly, the brains are becoming weaker And now when the brain is weaker, slightest of the environmental stress can cause a big risk of developing serious issues like depressions and anxieties. So undoubtedly, obesity has a very big role. While talking all of this, I want to ask you on a lighter note. I understand if you go out, there are these lot of negative impacts like smoking, vapes. If you sit at home and order also, you are saying, the food coming from outside is bad.
Yeah.
Can sitting inside four walls be safe?
So there's sedentary lifestyle versus actually staying indoors. So people stay indoors because of their work. We have so many IT companies, everybody's 9 to 5 staying indoors, but you try and do something to compensate that. So one of the most common deficiencies we see is vitamin D deficiency.
Right.
So almost everybody has that because most of the times we are sitting indoors in the AC.
Correct.
There are studies that say radon gas, because of the sunlight, all these buildings and the earth can emit radon gas, which is one of the toxins that you could inhale staying indoors. So that also can cause any aerodigestive tract cancers or lung cancer. But I don't want to get too much into detail because it's very hard to actually counsel them and give them a suggestion. Don't stay in, don't go out, You're not letting them live. What is the point of living? So the point of this discussion is that it is not about how much you do or how much you don't. It's always good to be aware.
Right.
Right? You have to be a devil's advocate. You can't say I'm always indoors, I'm not exposed to pollution, so I will not get cancer. So it is important to be aware of all these factors, how all of them together. Like I keep stressing about physical health, but I've never known that the kind of effect that processed food can cause, obesity can cause on depression and anxiety. And it is that, would you say dopamine release is the cause of that sugar addiction?
Yes.
Right?
Absolutely.
So our entire lives is about chasing this dopamine release. It's like a pursuit of happiness. Whatever makes you happy, you keep doing it. So whatever you do, don't do it in excess.
True.
Right? Everything in moderation is good for you.
Correct.
So that is, I think, should be the bottom line for this discussion.
So true.
Yeah.
Well, something interesting that you spoke about was vitamin D deficiencies, Dr. Karan. Because of late, we see a lot of researches as well as in our regular practice, I clearly see most of the times the severity of the depression and the low vitamin D levels are correlating. And many a times, correcting the vitamin D levels itself are reducing a lot of these mental health symptoms. And now when we talk about vitamin D, it's unfortunate that most of the individuals are not getting exposed to the sunlight.
Okay.
And when I talk to them about it, they talk about how they are sleeping between 2 a.m. and 10 a.m., which is their 8 hours of sleep, and that's the reason they can't get sunlight. So there is again a great misconception about sleeping 8 hours.
Okay.
People argue with me saying that I am sleeping 8 hours, but the important aspect is sleeping the right 8 hours.
Correct.
So when you have the melatonin levels in your blood, if you sleep, that is a good quality sleep. The reason I'm talking about this is sleep disturbances are one of the greatest risk factors for developing mental health issues. So somebody who's having a depression, normal with medicines right now, no symptoms, just has a few bad sleeping days and develops the illness again. So sleep disturbance can actually break the whole treatment also. So sleep is something that I've been seeing of late in most individuals. It is unfortunate that some people are working in the nights, but most of the times people who are not sleeping in the nights are sitting with their gadgets.
I've seen many of my friends these days in the recent past, they're complaining of insomnia, and it has become actually very common. They very casually come and say that I don't sleep in the night, I sleep at 5 a.m., 6 a.m. and then get up by 9, 10, and I'm okay with that 4 to 5 hours sleep. Right. So what is actually causing this insomnia? Is there any particular factor that you can pinpoint?
Well, I think a lot of things that we do in our day-to-day lifestyles have been impacting the sleep center in the brain. Starting from substance use, especially stimulants, like caffeine, and nowadays people have these energy drinks which are again having caffeine. A lot of supplements that individuals using are having a lot of caffeine, all of which can actually keep the brain awake. Okay. The second biggest thing is, the electronic gadgets that we use, because the blue radiation that is being emitted is activating the brain. undoubtedly the increased levels of stress, because every time there is stress, there is higher cortisol levels in the brain.
Correct.
And cortisol is keeping those areas of the brain which are necessary for being wakeful. So the wakefulness is active, so the sleep is automatically coming down. And even if you want to sleep, this is coming in between your sleep. So undoubtedly stress and sleep disturbances are hand in hand, and sleep disturbances and mental health issues are going hand in hand.
So that's a good point that you spoke about cortisol levels.
Right.
Because what it does physiologically to the body is basically kills all the cells, makes them to be very simple, was use simple words, lethargic.
Right.
And see, the cancer is caused when there is a damage to a DNA of a cell.
Right.
Right. And once there's damage to a cell, the body identifies that this cell is wrong.
Right.
And immediately kills it. But when there is a mutation in that, it hides from the rest of the body and it is not killed. And it continues to mutate itself and try to survive. And that's how cancer cell is formed.
Right.
Right. So when this cortisol level increases, it'll make the cells more prone to, or shields them against the body. So that DNA repair, what is there, it's supposed to be done, that is not done. And that is why these mutations occur. The cells continue to grow in a mutated manner, and that's how cancer is formed. So that's how indirectly, like you said, stress and sleep, how it is, it links to the cortisol level. That also is linked to cancer forming cells.
Right. So, for the last 30 minutes that I've been talking to you, I clearly understand that a lot of lifestyles that are present in the today's world, starting from ordering processed foods to vaping to bad sleeping, all of them are actually not just impacting the mental health, but also are a risk factor for cancer.
Yeah.
Now, keeping all of this in mind, the biggest question that I have in my mind is, who are these individuals who are at a risk of developing cancer? And if there are a lot of people following all these lifestyles, then when do we start looking for cancer? Because all I was told as a student was, if there is a risk factor in you, if there is a family history, then you probably at a particular age, you do these screenings. So is this still the same, or when do we start looking for cancer?
That's actually a very important question. So there is this big misconception that only if you have, family history of cancer, only then you would get cancer.
I believe that.
Hereditary cancers constitute only 5 to 10% of all the cancers. And there are so many articles and studies that have come now where the incidence of cancer has increased. The other misconception is the age. If you're 20, 30 years old, before there is no health problem that you could get. Now we are sitting and talking about so many things, and we have faced that in our circle, in our age group.
True.
So the incidence of cancer has also gone up in the younger age group, that is below 50 years. And the main cause, I'm going to pinpoint this and say the main cause is lifestyle changes.
Right.
Okay. It's a very funny statement that I read, which says the richer the country is, the more incidence of younger cancers. Right? Because you're exposed to so many different lifestyle changes because of more money. Before we used to think poor country, poor hygiene, poor health services, you're getting cancer.
Right.
Now it is all in our hands. We are actually doing this to ourselves. So when it comes to screening now, because I said that younger age group has more cancers, so forget about the hereditary part of it. Hereditary, yes, you are a risk of cancer. You go see an oncologist, they'll tell you what to do. Apart from that, to the general public, first and foremost, breast cancer has come at a very early age. Before, the cutoff used to be 45, 50 even. Now they say 30 years.
Right.
Okay. So 40 years if you don't have family history, 30 years if you do have family history, you have to get a mammogram done.
Right.
Most common is breast cancer. Second most common is lung cancer.
Right.
Lung cancer, unfortunately, screening is there only for the high-risk individuals. So only if you are 50 and above and you've been smoking all your life, we talk about 20 pack years. So if you're smoking a pack of cigarettes for more than 20 years, then from the age of 50 onwards, you're at a risk of lung cancer. Right. Unfortunately, lung cancer screening has not come to the younger age group. Now because we're talking about vaping, we're talking about pollutants, all this like internal radon that I spoke about, All this also cause lung cancer, but they have not come under screening yet.
Right.
The other thing is cervical cancer, which is the most common screening. One of the first screening methods that were started for cancer was cervical cancer, which is the pap smear. So pap smear is now recommended from 20 years itself. Okay, so pap smear as a test has to be done for every individual who's going to a gynecologist.
Right.
So whoever it is, doesn't matter that you have the infection or not infection, you're going to a gynecologist for a health problem, make sure that your gynecologist does a pap smear. For all women 30 and above, for all men 40 and above.
Right.
Simple thing is get a health checkup done.
Right.
Right?
Right.
Your full body check covers all this, whether it's a mammogram or a X-ray or an ultrasound, it will cover everything. Apart from cancer, we also see, heart attacks happening in younger people. So being aware of what is happening in your body, getting a yearly health check done is very, very important, and it is of paramount importance.
One question that most of my known patients or family members ask, especially who have a habit of smoking, how do I know the impact of it falling on my body? Because again, there is a misconception where they believe I'm smoking and I'm doing treadmill for 30 minutes, so my lungs are getting purified. So what do they need to do to understand what tests or what examinations should be done for them?
So the simplest thing is I'll send them to you. Because if they stop smoking, it will actually reverse all the effects.
Right.
So that effect, the reversal starts from about 1 to 2 years post you stop smoking. And it is not reversal not only for cancer, reversal for your heart problems, reversal for your lung to reoxygenate and pure themselves. So the first thing is coming to you, stop the addiction, stop smoking, and it will reverse everything.
Right.
Okay, but at the same time, don't come back and ask me again that I've stopped smoking, but I still got cancer. that could be so many other reasons to it. And in terms of what is recommended right now, everybody who is 50 years and above, like I said, what we do is a low dose CT scan. Okay, like when COVID was there, the first thing that you used to do is a high resolution CT scan.
Right.
To see the extent of involvement of COVID in your lungs. So what we do is a low dose CT scan. We do low dose because a CT scan repeated every year actually has adverse effects on your body.
Right.
We do a low dose CT scan to see if there are any infiltrates or nodules in the lung. And so that after that we can, follow it up accordingly. But
Right.
yearly low dose CT scan for people who are high risk of getting lung cancer, that is usually chronic smokers.
Right. So somewhere I think, this is a very important aspect that you spoke about, because we always believe in the concept of prevention is better than cure.
Correct.
So
Correct.
this is something that is going to help us understand the initial changes that are going to happen to your system before you actually develop a cancer.
Correct.
And you're able to identify it. We have that technology, but I think individuals should start accepting it, because we all
Exactly.
stay in a denial. A lot of people say, I only smoke 5 cigarettes,
Exactly.
so I don't smoke more. So don't believe in that is what you are saying.
Yeah, so we also spoke about everything that is inside out. We can't stop everything that you're exposed to, but being aware, accepting that you need to take care of your health, that itself will, make a huge difference.
Right. And now, since we were talking about prevention, Dr. Karan,
Yeah.
what do you think? Because today's discussion has really enlightened me to understand that there is a lot that is happening around us. We are just unaware about it. We go to hospitals and ask the doctor many questions about what medicine he is giving us, and we have a lot of inhibitions, but we unfortunately don't know what's happening in, the commonest things that are around us.
Correct.
How do you think, an individual can protect themselves or prevent themselves from developing serious?
So when you talk about prevention, first is primary prevention. That is simple thing is what all the lifestyle factors that we spoke about, stay away from it. Again, don't sit at home and make a list saying, I'm doing this, I'm not doing this, I'm doing that. Is this okay? Is this not okay? Just be aware, everything in moderation. If you want to drink, have, like you said, 1 or 2 drinks a week, still okay. Drink in moderation. If you want to order food from outside, eat in moderation. If you want to have red meat, then compensate that with more fruits and vegetables.
Right.
So that is the primary thing. Like what I read is 1 in every 4 cancers can be prevented just by making these small changes. Okay, that is the primary prevention that is there in your hands. Secondary is what I spoke about is screening. So screening, again, the problem with screening and the acceptance is that you think that you're anyway going to get cancer. That's why you're screening yourself.
Right.
But the important thing is, even if you do get cancer, getting it at an early stage, catching it at an early stage is very, very important. So early stage versus late stage is 90% cure rates versus 20% cure rate. So that makes a huge difference. So whatever it is, even if it is a heart attack, you catch it early, you can take care of it. Even if it is cancer, you catch it early, you can take care of it. It's not a death sentence like it used to be before. We can actually cure it, but trying to prevent it and catching it early is what we need to look at.
Like they say in this new era of 2020 cricket, you send your best batsman first.
Correct.
So you bring the best available facilities in screening and the best available treatments, and not wait till it becomes, a very scary situation.
Denial and ignorance.
Right.
Yeah.
Right.
So thank you guys for joining us. Hope this discussion was interesting enough for you, thought-provoking enough for you. So we want to encourage you also to be a part of this discussion. So try and place your questions and whatever you need to know, whatever you want to know from me and Dr. Virinchi, whether it's physical health, cancer, mental health, please place it in your comments. We'll be happy to respond to you. And also, please give us some ideas on what sort of topics, what sort of discussions that you would like to have, and we'll do our best to get that to you. Thank you.